I'm Dr. Taylor Gregory, the veterinarian and VP of Animal Health here at the Greensboro Science Center, and recently we did a pre-shipment exam on one of our red pandas, Usha. She is going to be going to the Columbus Zoo and Aquarium as part of breeding recommendations. To start off Usha's pre-shipment exam, we have to anesthetize her. To do that, we give her an intramuscular injection, and then after that she falls asleep. Once she's safe for us to handle, we move her onto our treatment table and then place a face mask on her where we can give her an inhalant anesthesia to maintain her anesthesia throughout the entire procedure. From there, it's monitoring and intubation. Sometimes intubation comes first if they're deep enough. Other times we'll get monitoring on while they get a little deeper anesthetically with that inhalant. As part of Usha's pre-shipment exam, we did a basic physical exam to get an overall assessment of her health. As part of a routine physical exam on any animal, what we'll do is we'll get a weight, we'll check their eyes and ears, we'll check inside their mouth, and we'll do a palpation of their body, palpation of their abdomen, as well as palpation of all their limbs to see if there's any joints that move abnormally. We updated her vaccines, we got blood work on her, and then we moved into more things, including radiographs. We took a variety of radiographs on her in part to get an update from her old ones, as well as to send off radiographs that the receiving institution wanted. So that included her thorax and her abdomen, as well as some of her limbs and her skull. We also did an ultrasound of her abdomen to just get a closer look as what was going on in that abdomen, because radiographs only show part of the picture. From there, we moved on to a dental on her. As part of every dental, what we'll do is we'll start with cleaning the teeth and cleaning out all the dirt and debris, and then I'll go in and check over the teeth. When I'm checking over the teeth, I'm assessing is there any pocketing, any areas around the teeth that there's gaps where there's not supposed to be, are there any fractures in the teeth or anything like that. This is very similar to exams your dogs and cats get when they go see the veterinarian at home for their dental exams. Based off of this, we noticed that Usha had quite a few of her teeth that did have issues with them. This can be pretty common in red pandas under human care because they do live longer. And so with that, it was in my opinion that she probably needs some of those teeth extracted. Once we finished Usha's exam and made the decision to wake her up, the first thing we'll do is we'll get everybody ready to wake her up. And then I'll give her a reversal, which basically reverses some of the drugs that we gave her initially and helps her wake up. We'll just give her oxygen, and then she wakes up slowly in her crate. Once she's able to swallow, we'll pull that endotracheal tube out, so we're no longer protecting her trachea because she doesn't need us to, and then she'll slowly wake up. She still has some effects of the drug on board, so she's still a little bit woozy, but over time those effects will go away and she'll be bright just like normal. We've had Usha here at the Greensboro Science Center for quite a while now, and although we are always sad to see our animals go to other institutions because we grow quite attached to them, it is the best thing for them and it's the best thing for the species overall, so we're happy to be a part of those breeding programs, and we're happy to exchange with other institutions where we know they will receive excellent care just like they do here.